All right, Kaylin, welcome to the show today. We're going to talk about thyroid a little bit. So why don't you introduce yourself to our group?
Sure, of course. My name is Kaylin Ameling. I'm a pharmacist with MedQuest Pharmacy. I have been in the pharmacy industry for the past 15 years in a variety of roles, and my passion really lies with hormone replacement therapy. So I'm excited to be here, especially to talk about thyroid with you.
Great. So the biggest question is, why am I so tired all the time?
It's a common question that we see a lot, and this definitely happens with low thyroid. Other things that you may, in addition to feeling tired, you probably notice that your energy levels are low, you feel cold all the time. You may notice that your skin is a little drier, your hair seems brittle, just not feeling well. And those are all things that can occur with low thyroid.
I might skip around a little bit, but that sure seems like what happens as we get older, right? Like when we age and we get older, everybody says, well, you're just getting old, but is that really the problem?
The most important thing when we're considering aging is looking at the why, not just attributing how we're feeling and how things are changing to the fact that we're getting older. We don't just have to live with these changes. This is not just something that happens, it's something that can be treated. I would say if you're feeling that way, the first thing you need to do is have your thyroid levels checked, have your other hormone levels checked, because it's probably a dip in your hormone levels. As we age, naturally our hormone levels are going to dip, but we don't have to just stand by and let it happen.
Well, that is good to know. So why don't you talk to us a little bit about, I know, I do some reading on thyroid and they talk about T4 and they talk about T3 and TSH. I don't really know what any of it means or what any of them do.
Sure. They're all just different players in our overall thyroid health. So TSH stands for thyroid stimulating hormone. It's produced by our pituitary gland and in our brain, and it sends it out to our thyroid gland, which is located in our throat, in our neck, and tells our body, hey, we need more thyroid. Since our thyroid is essential for our metabolism, our energy levels, things like that, whenever we eat, whenever we need to move, our body's going to be hopefully producing that TSH to tell our thyroid to make more thyroid hormone. The two thyroid hormones that our thyroid gland produces are T4, which is also known as levothyroxine, and T3, which is liothyronine. It produces more of the T4, and then it shoots it out into our body, and then it target areas within our body, like our gut, for example, for metabolism. It's going to turn it into T3, which is the most active form that our body can use and recognize, and get our metabolism going again.
Can you just review for everybody, like what are the key symptoms of people suffering from low thyroid?
Absolutely. Feeling cold all the time, feeling very tired, very sluggish, having dry skin, noticing changes in your hair, having your hair feel more brittle, like it's falling out a lot, just feeling like you are very fatigued, lacking in energy, just don't want to do things. Sometimes even these symptoms can mimic depression, and so watching out for those kind of symptoms as well. It may just be your thyroid.
Wow, that is really good to know. Talk to us a little bit about the different types of medications that are available on the market today.
Fortunately, there are a lot of medications, but unfortunately, they're not always used in the best way, in the most optimal way. The one that we see a lot of, and that a lot of patients and doctors really like, is the desiccated porcine thyroid. It does come from pig thyroid. It contains a small amount of T3, a small amount of T4, and then trace amounts of some other bits of thyroid hormone that are sometimes helpful, including T1, T2, calcitonin, iodine. These are all components of thyroid that our body uses to make sure that we're at our best levels. So this one is available. You may have heard of it as Armour Thyroid, NP Thyroid, Nature-Throid. It's also available through compounding pharmacies. Compounding pharmacies can take the raw thyroid powder and make it into any dose that you need, not just what's available out there commercially. Other options include things like Synthroid, you may have heard of, which is levothyroxine or T4, and Cytomel, which is liothyronine or T3. They're a little bit more limited in the doses that they have available, and in order to get T4 and T3, you'd have to take 2 tablets, which may be kind of cumbersome and not ideal. And then last but not least, there's another option with compounding where a compounding pharmacy can take the individual T3 and T4 powders and combine them into a capsule that is specific to you and your needs based on your levels.
Thyroid sounds pretty complicated.
Yeah, there are a lot of moving parts to thyroid, a lot of different ways to look at it, and a lot of things. But once you get the right dose, once you find a doctor who can help you get the medication that you need, it's a pretty easy fix for a lot of really troublesome symptoms.
And I think that's key, is finding the right provider. I know me, for example, I'm a very poor converter of T4 to T3. And so the only thing that works for me is to take a combination medication. Otherwise, I just really can't function.
Yeah.
So I really think this is a super important topic. So if you're feeling all these symptoms and you feel bad, and if you're on thyroid and it doesn't work, you should really try to find a provider. It's really life-changing.
Absolutely, absolutely. And through the Academy of Preventive and Innovative Medicine, they train doctors to be able to have the tools and the know-how to address thyroid issues and other hormone issues for that matter. Any doctor that has been trained through the Academy is available on worldlinkmedical.com. You can search for them in the Find a Provider tab there, and get started, get things going, and get your hormones back on track.
Great. Thanks so much for being here today. We really appreciate it.
Thank you.
Yep.